Good morning, everyone. Welcome to the third ELETS Healthcare Transformation Summit 2022. The two-day virtual event on the platform Avatar will be hosting a galaxy of eminent healthcare leaders deliberating on the various facets of technology driving futuristic healthcare. The need to embrace technology to remain relevant in the rapidly evolving healthcare scenario has become pertinent. Through the various editions of the Healthcare Transformation Summit, ELETS Technomedia and eHealth has been looking to capture the significance and evolution of health IT. I would now like to request Dr. Ravi Gupta, CEO and founder, ELETS Technomedia, to welcome our esteemed dignitaries and commence the inaugural session of the third ELETS Healthcare Transformation Summit 2022. Over to you, sir.
Thank you, Garima. Welcome, everyone. Welcome all our esteemed speakers and delegates who are joining in this event. And this is an important event, which is the third edition of Healthcare Transformations Summit, which we are doing. And we are all aware that lots of effort by the National Health Authority, Ministry of Health, and overall Ayushman Bharat scheme by the government of India is taking up IT implementation in the healthcare sector in a big way. And we are proud to inform you all that ELETS has been publishing this in a magazine called eHealth for last 18 odd years. We started this magazine in 2005, and we were and we are still the India's first and the only magazine on healthcare innovations through ICT. And we have been relentlessly creating awareness about ICT adoption in healthcare sector, both government and the private sector. And we have been organizing several conferences, workshops across the country. We have reached out to more than 50 cities of the country and around 20 states across India. And we have also organized healthcare conferences, not only in India, but also abroad in Thailand, Malaysia, Sri Lanka, Dhaka, Dubai, Bahrain, Cambridge, USA, and various other places. And our agenda is to help create awareness about ICT adoption in the healthcare sector, and ICT improves efficiency of the sector. ICT improves the patient healthcare delivery in a more friendly manner, and the whole idea is to build up a community of practice where healthcare professionals, healthcare stakeholders, healthcare policymakers are deliberating about the whole adoption of healthcare ICT tools and techniques. We are. I also welcome our esteemed delegates who are here. More than 500 people have already joined on the platform Avatar. And we have this portal called ehealth.eletsonline.com, on which we will be uploading the report of this event with the detailed session reports. And we are updating on live on the social media also, on the Facebook, Twitter, and LinkedIn of ELETS handles. And also, we are happy to inform you that a report of this event will be published in the next issue of eHealth magazine. We are joined in by several esteemed speakers, around 70 speakers from all around the country, around 11 sessions where we have, and we have the whole stakeholders from various parts of the healthcare ecosystem, policymakers. We have the healthcare CEOs, the medical directors, chief operating officers, healthcare IT heads, healthcare digital marketing heads, because all these people, everyone has an important stake in this adoption of ICT in the health sector. And let me welcome our esteemed speaker here, he is our esteemed speaker is from the government of JNK, and he is Mr. Yasin M. Chaudhary, who is a mission director of National Health Mission Jammu and Kashmir. So it's a very proud moment for us. JNK is an important state of the country with a diverse set of geographical factors. Very difficult terrain conditions are there, difficult weather conditions are there, and we have the healthcare centers spread all over the state, and where reaching itself is not easy sometimes due to extreme weather. In these situations, role of IT becomes much more important in connecting our healthcare centers, healthcare workers. And let me request our keynote speaker, Yasin Chaudhary ji, to elaborate on the various challenges of the healthcare sector in the each state, and how is the state dealing with these issues, and what is the vision of the state in the healthcare sector. Welcome, Yasin ji. Over to you.
Right. Thank you. Thank you so much, Dr. Gupta, and thank you, Team Elets, for this opportunity. I firstly congratulate you for holding this extremely important and relevant event, which in today's time is must for gathering knowledge and building this community towards achieving this goal of futuristic healthcare. I firstly welcome my esteemed colleague, Dr. Ratan Kelkar, sir, my counterpart from Kerala. And I also welcome all participants who have joined us online today. So I begin by saying, they say data is the new oil. What I say is that health data is the new gold. And the idea of futuristic healthcare is something which would be completely and totally based upon the data of patients, the data of medical records, and all the gambit of under medical records that we get, and how we manage to leverage it and make the healthcare system more accessible for the public. I begin by contextualizing the leading health sector goal which WHO has laid out for us. That is UHC, universal health coverage. I'm sure you all must have heard this phrase somewhere or the other. And what does it mean exactly? Is that we must ensure the same and equal standards of healthcare for each and every person on the planet. For us here in India, as the next big superpower, it is imperative that before we call ourselves a superpower, we must ensure that all our people and citizens have the same quality of healthcare. And how do we actually leverage technology to do that is what we must all ponder upon. When we talk about universal health coverage, we there are two main pillars: equity and equality. And of course, it is, as you rightly pointed out, means reaching out to the most vulnerable and disadvantaged sections of the community, and ensuring that they get the same level of healthcare as the most privileged ones. So that means a tribal in a remote, mountainous village in the near the LOC in JNK should have the same level of healthcare as you know a well-earning techie in Bangalore. So there are obviously these existing barriers of access and quality, which ail our system. But if we keep the goal of a futuristic healthcare system in mind, how do we intend to break them, and where does technology come in? I begin by using the our response during the COVID pandemic as an example. It was a time when we had to match the pace at which the virus was exploding. So mass coverage was the key. How do we urgently expand and scale up our, say, testing, our vaccination, our ICU capacity? So when we talk about scaling up, we obviously mean a system which is durable and expandable. And the key here is, as I said, leveraging technology in a way which can enable us to repeat those services for numerous people. Now, to be honest, healthcare innovation, the way it has grown and uh, taken to various turns in our country, has been both centralized as well as decentralized. When I say centralized, I mean it's been driven from the center, from the Ministry of Health and Family Welfare and NHA and other such bodies, and passed down to the states, or there have been localized solutions. And whenever we talk about any such designs, we have to obviously keep in mind the huge diversity which this country has. So we have like some really, good performing hi-fi private hospital chains like Apollo and Medanta and Fortis. And we also have, basic sub-centers, government-run sub-centers, which provide minimum level of services. And how do we ensure that all of them come together in an integrated system, which can, give equitable service to all our citizens? Let me also add here that we are a mature nation, so we cannot think about building something from scratch. Whatever solution we have to think of would obviously have to take into consideration whatever existing infrastructure we have. Now, to give you a bit of context as to where we stand in terms of technical innovations in this country, so I believe that within the ministry, the National Health Mission has, of course, been at the forefront of introducing technology-based innovations, and we have actually not been late into the party. In fact, we have some very strong and old systems and portals like the HMI, the Health Management Information System, and the RCH, Reproductive and Child Health Portal, which has been around for almost a decade, and which numerous ASHA workers, A&M workers, health workers are accessing and feeding data into. So we actually already have an extremely useful data set with us, which has been, which is going to be our foundational building block for any further, further solutions. Also, we have to understand that patient data gathering or public health data gathering is happening at two levels. One, from the community side, where the reporting is done, say, by the, as I said, the ASHA or the ANM, or say the sub centers or PHCs, and of course at the tertiary level, where whenever a person goes for an OPD or an IPD, and undergoes any surgery or procedures, and all the medical records which are generated as a part of it. We also have conceptualized and developed numerous technologies for specific subsectors within health. So, for instance, we have even masterpiece software portal which works efficiently to manage our vaccination outreach and coverage. We also have MCT as the mother and child tracking system. We now also have Anmol, the ANM online portal, and where all our ANMs are actually feeding data into using a tablet, which we've handed out to all of them, rather than the traditional paper register. We also have the ODAS, the Oxygen Demand Aggregation System, which we conceived and conceptualized almost instantly during the second wave, when oxygen scarcity was a crisis. There are all these things already existing, and there are further solutions at the user end, which are basically accessed by the public directly, and also adding further data into our system. So, say for instance, the 108 ambulance helpline, whatever calls and services that we are getting logged, so we are able to understand the distribution of emergency health response systems. Or we also have those 104 centralized health helpline, which is possibly going to be the most important source of building our health data. And both of these helplines are functioning very well in most parts of the country, including JNK today. The numerous other things, for instance, even our biomedical equipment maintenance program has been digitized. That is enabling your in-house service delivery in a better way for local governments. We further talk about a more decentralized application of technology here, and I'll give you a few more examples as to how we at our level have done so many of these innovations. So we have conceptualized an app for one of the oldest schemes of NHM, that is RBSK, Rashtra Bal Swasthya Karyakram, and wherein we are actually logging all the the checkups which our school children are undergoing through the RBSK teams online, and hence building health records of each student, with the idea that they will be further added to the UHID of that child when he becomes an adult. We also have actually introduced, for the first time in the country, a live geo tracking of ambulance whenever it is dispatched, and this works as an app which we call Sahayak Doot. So the first responder at the accident site can actually track the movement of the ambulance, just like we say track an Uber or Ola cab. We also have conceptualized a dialysis scheduling alarm app for our numerous kidney patients. We also have created an app for our 13,000 plus ASHAs in JNK, for whom getting their incentives was always an issue. So whatever we have actually linked it with the PFMS system, ensuring that they're getting their incentives on time. More importantly, during COVID, uh, the Ministry of Health and Family Welfare developed what in my opinion is the most robust and successful pandemic technology innovation throughout the world, and that was COVID. Our success in such in this success our success in the COVID vaccination was possible only because of this extremely durable and successful app, which the website and app which the ministry developed, and which I think will continue to remain a huge example. Similarly, at JNK, in JNK, we actually developed something called Swasthya Nidhi during the first wave itself, when we wanted to actually, undertake mass screening and surveillance of the population. So all this has been need based and has come up in a decentralized manner. Now, how do we bring it all together? And this is where I think NHA comes in, and I must give all credit and respect to worthy respected RS Sharma sir, who has been the leading technocrat in this country for a decade or so. The success of Aadhaar has been replicated in by NHA in the form of the wondrous ABPMJY, Ayushman Bharat, Pradhan Mantri Jan Arogya Yojana. I also happen to be CEO SHA here, and I'm proud to say JNK is one of the few states in the country which actually has complete universal coverage, not just for retail population, but for the whole coverage. And with ABPMJY, both the technologies, the BIS, the Beneficiary Identification System, and the TMS, the Transaction Management System, are completely developed by NHA, and we depend on it wholesomely. We have not developed any local technological extensions, and I believe for the maintaining the essence of the scheme, which means that say a person from Kashmir can actually use his ABPMJY card in Kerala. Ensuring that universality is can only be possible if we have centralized solutions, and that's why I believe that the work NHA is doing is so great and important. That's the first time in the country, the first time in history, they're developing systems which are roping in all these, the billion citizens of this country, and ensuring the same level of services no matter which place they are in. The millions of transactions which have been successfully happening on TMS is a testimony to that. And NHA, of course, has been the pallbearer of the ambitious ABDM, of which I'm proud to say I am a part of. I am the nodal officer of ABDM in JNK as well. And I think it is possibly the most massive and most ambitious program in the history of not just healthcare, but IT development anywhere in the world. When we talk about ABDM, we mean maintaining health records for each and every Indian citizen in a manner which ensures both data privacy and data security. Let's compare it with the US social security system or the UK's National Health Service systems, and both of them you would see would fall short of on certain accounts, be it say interoperability or application to only select few population demographic groups, or limited to a few hospitals or institutions also. But ABDM, the way it has been designed through the form of this basic interoperable platform, the first of its kind in the world, which will be using individual based UHID, Universal Health ID, which has been termed as the ABHA ID, will become every Indian citizen's license or passport for quality and better healthcare. How beautiful can that be? And I would actually recount RS Sharma sir's words at a meeting once. He said that when we build such solutions, we build for universality, we build for compatibility, and we build for durability. Otherwise, it's not worth getting into. We just don't want ragtag innovation to fail. It's a very ambitious and a very serious project, and this is where our country's technological capabilities are actually being put to public service. They're actually being put to use for the public, and not just limited to building outsourced software solutions for clients in the Western world. We are building something for our own citizens. Now, the further beauty of ABDM is, and I really commend NHA once again, particularly Dr. Parveen Gidam sir, the way it's been designed was to keep in mind that whatever solutions we have already, whatever local HMIS hospital MIS solutions that we have already, must be compatible with them. They must be completely compatible and integratable with our with the interoperable platform of ABDM. So that means that we don't have to worry about scrapping everything that we have done for over 2 decades and start from scratch. And they have been offering like such detailed services that I'm sure that the transition to fully functional ABA ID usage transaction system would be very very soon, much sooner than we anticipate. So we as a country are at right now a very very critical juncture where we can introduce such brilliant technologies at just the right initial time, so that they will be picked up by local governments, by the public, and they can be scaled up. The success of Aadhaar, the success of ABPMJY, and the success of Cowin are testimonies to the fact that yes, technological solutions work in resolving the biggest challenges in healthcare. And because health is a social sector and we are a welfare state, there is no running away from it. I, on behalf of my colleagues in the government across the country, I'm very confident to say that we very well understand and accept the importance of technology in changing the face of healthcare in this country, and we are very very eager to look forward to further solutions. That will be all from my side today. Thank you so much, everyone, for patient listening. Thank you.
Yeah, fantastic speech, Yasinji, and you have highlighted the very much importance of this importance of IT in this healthcare sector, and especially you have talked about the importance of centralized solutions so that there is interoperability. And uh, let me briefly like ask you that being a such a diverse state and and having extreme weather conditions and like unreachable areas also in your state, like how do you and I think like connectivity is still an issue in the some of the parts of the state. So how do you look at like addressing this healthcare IT or proliferation, specifically in the rural areas? Like how do you answer that?
Right. So, firstly, as I remarked, that
Hmm,
there are barriers of access and quality, which we
hmm,
have to break through. Access,
hmm,
obviously, because of geographical distances, remoteness, rural areas, and
hmm,
quality, of course, gets diluted as we go down the line. So, how
hmm,
do we ensure,
hmm,
equity in this scenario?
hmm,
We have been trying very hard to build a massive cadre of, foot soldiers, public health foot
hmm,
soldiers, in the form of ANMs and ASHA workers and FMPHWs, who
hmm,
can actually, who have been, I'm confident to say, successful in building a robust community-based preventive healthcare model.
hmm,
Because we cannot bring tertiary care to the doorstep of each and every remotely located rural person in JNK. So investing in community public health
hmm,
preventive
hmm,
care is
hmm,
a solution which the ministry and WHO have been working on for a long time. In fact, the whole idea behind NHM was that, and JNK had been pushing those things for a very long time. And the use of technology, say for instance, the use of Anmol Online by the ANM ensures that he is ensuring data logging of health data of a tribal who's located in a mountainous village, and
hmm,
that data is accessible to us. So we are actually, and not just this app, but numerous other apps. And so in through these apps and technologies, we are able to actually screen people and identify those who would need early intervention and facilitate the same for them. Same thing for PMJY, person who's Ayushman card. We have actually uh, uh, been going for an extremely decentralized manner of in BIS enrollments, and ensuring that everybody just manages to get a card, so that
hmm,
he carries around in his pocket, and whenever he's rushed to tertiary care, he is able to use it. So rather than waiting for him to get a card after he requires it. So there are those things that we are trying to address, and obviously there will be always issues of some deficiencies here and there, and but it's a long way ahead. It's a long way ahead.
yes, yes, of course.
Yeah.
Yeah, fantastic. And Yasin ji, there is a program by the government of India with the Ministry of IT, like talking about digital India. So Digital India also promotes usage of IT in each department of the government. So how do you see the convergence between Digital India objectives and the healthcare IT objectives?
So obviously, Digital India objectives are both from the government side in terms of, say, digitizing our public services and other, things that we undertake, and also for the user, the citizen, so that he can access those public services through his smartphone or laptop. So that's where we have to develop, as I said, user and solutions and service delivery solutions. Now, I'll give an example. If when you say, how do we make it easier for, I mean, the Digital India ideal or objective is to ensure that everybody has access to, those services online as well. But the first impediment, which Digital India also well recognizes, that not everyone in this country has a smartphone. Not everyone in this country has data access, or rather access to internet. So how do we bridge that gap? And this is where we look for the local solutions. So, for instance, for the health and wellness centers, we have for running the eSanjeevani teleconsultations, we actually ensure that our MLHP, the mid-level health provider, there are almost 2,000 of them in JNK who are located in the remotest subcenters. They actually use their smartphones to run the eSanjeevani app, and we have ensured that the subcenters at least have some sort of internet connectivity, either broadband or mobile. And he's helping the poor villager in the remote area actually connect to a consultant who's sitting in Srinagar or Jammu through his own phone. So this is a very simple solution that works. A similar solution would be, say, decentralizing the BIS enrollment in PMJY by actually going for a non biometric based system, OTP based system, so that we are not just constrained by using CSC operator with a biometric machine, but anybody who's having a smartphone and is authorized and given a BIS login ID, he can actually walk up to anybody and record his details. And we are also looking at everywhere offline data logging options, so that the data collection can happen in areas without internet connectivity, and whenever the collector or the official comes down to area with better connectivity, the uplink ensures all the data is transmitted. So all these solutions are ensuring that the public which is bereft of internet access manages to get connected to the system somehow. Obviously, digital literacy would be emphasized in a massive way, and Digital India is ensuring that in a massive manner. The campaigns are huge, and I am sure that every citizen is pretty much realizing the importance of digital services and adapting to them in the coming months.
Sure. And another point is that your state is perhaps the only state in a country where you have been shifting capitals in the extreme weather conditions. So I have read that in this year because of COVID, perhaps it did not happen, and because of this, a lot of activities became digital in various government departments. So if you can talk about it briefly and explain about it, that how it
All
happened.
thanks to NIC's e-office. We had the solution almost 4 years ago, and we are using it very successfully. So just to give you an example, that up until a couple of years ago, we were lugging each and every file all in the secretariat and all the as we say, Darbar move
Yes.
department, including mine. We were
Hmm.
lugging all those files, packing them in trunks every 6 months. Putting them in trucks, and
Hmm.
they would bring them to Jammu and then to Srinagar, and that's something that we've been doing for decades now. But with the Darbar move constraint because of the COVID pandemic, the use of e-office was a perfect solution, which we already had. So honestly, we didn't had to actually think of something else. It was already there, and
Hmm.
almost 60% of the staff was using it already before that. And now I'm
Hmm.
proud to say 100% of employees in JNK are using e-office.
Okay. And many people are saying that COVID is the new chief technology officer for all the organizations across the globe. So how is do you think the same effect has happened in the health department, that IT adoption because of the COVID has increased? You want to say that?
Certainly, certainly. In fact, we in JNK were possibly one of the first ones to understand that controlling COVID requires, a mass outreach.
Hmm,
We have to, our pace of reaching out
hmm,
should be more than the speed at which the virus is expanding. And how do we outrun the virus? By using technology, as simple as
hmm,
that. So, obviously, because it's a pandemic, it's a
hmm,
virus. So, basic epidemiological standards say that surveillance and screening of the mass population is required. Now, sure, we had rolled out thousands of foot soldiers to say collect samples, vaccinate people, and all. But how do we ensure that everything is happening on time, and how we're tracking, keeping track of it, how are we recording the data, and how are we analyzing the data, was all possible because of IT solutions in the form of apps. And this is why I mentioned COVID being such a big success, the main reason for our vaccination breakthrough here in the country. And in fact, JNK, as you know, was the second state to achieve 100% vaccination, both first dose as well as second dose for both age groups. And it was only possible because we adapted COVID very, very early on. In fact,
okay.
at some point, we also developed a localized version called JKWin uh, to take care of some priority health groups so that we could open up earlier in the time of lockdown. Second solution I mentioned was the Swasthanidhi app, which we used
Yes.
for recording and recording each and every test that we were doing. So basically, how we killed the virus, and I'm sure you would have heard that JNK counted as one of the few states where mortality and even positivity had been at an all-time low. And main
Yes.
reason was that we had developed this practice of a guillotine cut, which we would undertake in the form of a mass sweep testing exercise that we, and for that Swasthya Nidhi was developed. Swasthya Nidhi is indigenous to JNK. It was
Okay.
developed by us only, and it hasn't been tried any. It hasn't been developed anywhere else in the country. So what we did basically was, is during the first wave and the second wave,
Hmm,
just testing day after day only the positive contacts. We actually went all out into the field and tested everyone. So I
okay.
remember the first drive of Swasthya. I was actually a deputy commissioner back then, and
Hmm.
we tested our whole population of JNK and in my district, District Shopian, in 1.5 weeks.
Wow.
4.5 lakh population we tested in 1.5 weeks, all because everybody was able to quickly use a rat, log the data, move on to the next house. So the main thing here is understanding how technology can be used to scale up solutions and
Hmm.
ensure proper mass coverage of each and everything, be it beneficiary oriented schemes, or be it any departmental exercise that needs to be undertaken.
Fantastic. So, in last 2 years, specifically the importance of the health department has dramatically increased in each state, because now people are realizing that like health department is one of the most important departments if you look at public safety issues. So, if you can briefly talk about that in your state, how is has the healthcare department itself evolved in the last 2 years, and what are the changes being foreseen in next 2 3 years, if like you have some ideas you want to give?
Right, of course. The previous question, as you said, that COVID was the chief technology officer, became the chief technology officer for all of us,
Hmm,
rightly so. But obviously,
hmm,
there was a substantial amount of intra-departmental reorientation
hmm,
in terms of the priorities, because for the last 2 years, all the whole department has been entirely focusing on COVID majorly, while also at the same time ensuring that the critical and necessary and essential OPD IPD services are not derailed. And in fact, I'm proud to say in JNK, we never actually suspended our OPDs anywhere, even during the
okay.
first wave or second wave. And
Okay.
so certain elective surgeries were postponed, but even IPD services were maintained on track. So that sort of reorientation, or rather recalibration of the intra-departmental resources, so as to handle both the priorities, was something that required great insight upon. And I'm proud to say that under the leadership of successive lieutenant governors, chief secretaries, and financial commissioner health, we have managed the task very well. There was also an issue of mobilizing resources, COVID-specific
Yes.
resources, which is RAT kits, RT-PCR kits, swab sticks, testing reagents, and finally COVID vaccination. So resource mobilization. And I remember the time when the vaccination was launched, and every state was running after Serum Institute of India and
Yes.
Bharat Biotech, to who will be the first one to reach them and stake their share of the vaccine. But of course, it was made available in plenty already. But still, whatever we had, how do we ration it out? Whom do we prioritize? Whom do we not prioritize? How do we save more lives in that process? And most importantly, building our ICU IPD capacity. That was the key when people were looking for so urgently looking for beds, and many of them were able to get one very late. We in JNK were actually able to ensure that nobody, not even a single person, who required an oxygen bed and arrived at the hospital had to go back or was denied. This did not happen in JNK.
Okay.
I'm very proud to say that it was possible because the infrastructure capacity expansion that we had to do was
Hmm.
made possible by the hard work of our numerous medical superintendents who worked overtime to achieve it.
Fantastic. Like, and the hospital infrastructure, like private sector hospitals played a very important role outside JNK. But what was the situation in like JNK? Because in you have several remote places where there might be lack of the private sector, and including the government hospitals also, perhaps. So I have no idea if you can explain about it.
So actually, in JNK, we have a predominant public government health
Okay.
system in place.
Okay.
We only have like 75 private hospitals. Very few are large ones. Most are small and mid-level nursing
Hmm.
homes. And they played their part in the pandemic by ensuring that they take load of all the IPD, some of the IPD, which we could not prioritize in public hospitals. Some of these
Hmm.
private hospitals also served as COVID hospitals, and they did their part. They also ensured proper coverage under PMJY,
Hmm.
and they're still doing the same. Apart from the private sector, and obviously there was the issue of compliance to regulated rates for
Hmm.
RAT tests and RT-PCR tests, and the vaccination, which the private sector was doing,
Hmm.
and most importantly, the CT scans, the HR CT scans of lungs, which was something which every COVID patient required, and that could have been a money minting opportunity for any dubious CT scan provider. So, compliance to our rate regulations and our needs was very perfectly dealt with by our local private hospital associations. And also, apart from the hospitals, private leading conglomerates and corporates, they actually helped out to us so much in the form of CSR. We've gotten PSA OGPs, the pressure swing absorption oxygen generation plants. We've got oxygen concentrators. We've got nebulizers. We've got some deep, BiPAPs, and so many accessories in the form of donations from so many companies, which certainly helped us in our COVID control effort.
And now the government in your state is looking at attracting investment from the private sector. So are you looking at investments in the healthcare or medical technology sector also?
Sure. In fact, we have big plans for scaling up the same. We, as a government, even though the as I said, the public hospitals play the predominant role, but we also know that for improving the quality of healthcare and also outreach, we do need to increase the numbers of private hospitals. And post Article 370 revocation, we have opened up for a few private investments, and we've got a lot of proposals also. Our industries department is working actively with our health department in working out the same. Large Medicity is being planned, one in Kashmir division and one in Jammu division, which will provide state-of-the-art tertiary healthcare. Also, it is imperative for us to develop these solutions, develop these institutions here, because many areas of J&K remain inaccessible for almost a week or so. I mean, if we have a bad spell of snowfall in Kashmir Valley, we don't have any flights coming in and out of it for almost a week at times, and sometimes our main national highway also gets choked and blocked because of landslides. So people are not able to fly out to Delhi or Mumbai for any super specialty treatment. So that is why it's imperative for us to develop them locally here, and that's why we are inviting investments from private hospitals for the same.
Fantastic. So it has been a delight to listen a wide spectrum of issues related to healthcare in the state of Jammu and Kashmir. So we are very thankful, Yasin ji, for joining us. And
Thank you.
we will conclude here. And let me invite Garima on the screen.
Thank you, Yasin sir, for your wonderful insights and the way ahead for the healthcare sector in Jammu and Kashmir. It was a delight to listen to your initiatives, and we really are very thankful for your presence here. And so, please accept a small token from our end. This token of gratitude for your presence, your time, and your insights at the third
Thank
ELETS
you.
Healthcare Transformation Summit. Thank you so much, sir.
Thank you, Ms. Pant. Thank you so much, Dr. Gupta, for the invite. It was a pleasure speaking here.
Same
Thank
here.
you.
And thank you. And namaskar to you. Thank you so much.
Thank you so much.